Hi, I'm Dr. Bob Margeas, and I am in full-time private practice in Des Moines, Iowa. Today I'd like to talk to you a little bit about how I present cases to my patients, because we get patients that come in that have fractured teeth, or perhaps they have a tooth that has a subclinical fracture, and they say to you, it only hurts when I bite on it, right here. And so you put the tooth sleuth on the tooth, you say, yep, there appears to be a crack. You say, well, my recommendation would be to have a crown put on. Well, a lot of times the patient will say, well, it doesn't hurt that much. I said, well, great. I said, the worst case scenario is the tooth could break, it could split. We could still maybe do a crown on it, but you may need to have endodontics done. You may need to have crown lengthening done, or you may, in the worst case scenario, lose a tooth and have an implant. Nobody dies usually by losing a tooth. And I say to the patient, I say, this is your mouth, it's your time, it's your money. This is what my recommendation would be, but it's up to you to decide if you want to have that treatment done. And, I put the ball in their court. We don't call the patient up on a regular basis and say, are you ready to have that crown done? You came in here and the tooth was cracked and you're ready to have it done. They're usually grown adults that can make the decision themselves. And what I want to do is educate the patient. Another example, we have patients that come in that perhaps are 21 years old, have a little bit of spacing, or maybe the teeth are crooked, and they say they want to have veneers. Well, I do a lot of veneers in my practice when it's the right situation. A lot of times the patients really need orthodontics. And could I talk the patient out of having orthodontics? Of course I could. I could say, well, you could have orthodontics, but you have those metal brackets, and it's going to take 2 to 3 years for them to straighten your teeth. Or I can do porcelain veneers in 2 weeks, where you come in, we prepare your teeth, and 2 weeks later you have perfectly straight teeth. What are they going to do? They're probably going to have the veneers because of the way that I presented the case. Now, is that the right thing to do? No, I don't really believe it is. I think that we have to be honest with our patients. And when a patient comes in that wants you to do things that they want to have done, but it's not the right thing to do, a good friend of mine, Dr. Rob Ritter, says to their patients, and I use the same line, just because you don't want to do the right thing doesn't mean I'm going to do the wrong thing. Because you can always get someone to try to talk you into doing something that you don't want to do. And the minute you start feeling sorry for your patients, that's when the problems begin. When you say, okay, I'll just do this, the patient talks you into it. And what happens? A lot of times you'll have failures. And who owns that problem now? We do. And so I don't want to, have a patient talk me into doing something that I know is not the right thing to do. And so we're honest with our patients. I myself have a production goal in my head that I need to do in order to meet my financial responsibility. But I don't want to put the pressure on my staff saying, well, we need to do 100 crowns this month, and now we're at 90. Does that mean the last 10 patients are going to get a crown? So I think if you're honest with your patient and you're genuinely sincere, patients are going to accept their treatment. And I will tell you this, over the last 28 years now of private practice, I've never had a year worse than my previous year in dentistry. And even through the recession, my production was still better than the year before. And hopefully, you'll be able to pick up some information from this little video that I'm doing that you can incorporate in your own practice. Have a great 2014.